come in like that.
Okay, you're going.
All right, so TexarkanaFYI.com, Horn Hog Radio. Education.
Yes, sir.
It's important. So with COVID and the flu season, I go to my doctor, Tim Reynolds, and Baby Doc. Have we introduced him?
I don't think we have.
No, you haven't been on one of these yet. Spencer. Also a doctor, following in Daddy's footsteps. But you're at LSU
Yes,
Hospital. A lot of COVID.
Oh yeah.
Lots and lots of COVID.
Daily.
Tell me, Doc, we were talking earlier about the different testing. There's a lot of folks that are confused. Some people want to get these quick tests.
Yep.
Some people don't want to do can you explain the difference between these tests, the COVID tests?
So it's changed, right? So in March, when this all first started, there were very strict restrictions on who we could test.
Right.
But the main reason for that was there just weren't a lot of tests.
Right,
We wanted to use them. And as time's gone on, we've gotten better tests, we've got some rapid tests that we didn't have back in that time. And so where we are today is there's essentially 3 tests that everybody needs to know about. There's the rapid test, and the rapid test is the ones that you see advertised. You can go in, you can get a test, and 20 minutes later you have the result.
Right.
It's a good test, it's rapid, it's not as accurate.
That's the one that a lot of people talk about false positives.
Yes, a lot of false positives, a lot of false negatives. But the good news is you can get the answer today.
Right.
The PCR test is the test that has to be sent off somewhere. You usually get the results in 24 to 36 hours. It's more accurate, but you have to wait, right?
Now,
And
if
so-
somebody thought they had COVID and they took the PCR test, the advice would be to if you think, then kind of quarantine yourself, isolate yourself.
Absolutely. So the treatment's the same, right? Regardless. If you get a fast test, if you're having symptoms, you need to be quarantined. But I think where we're at now, and then the third test, and I'll kind of come back to how we use these 3. The third test is the antibody test. The antibody test does not tell you if you have COVID. It tells you if you had COVID, and now your body's immune to it. So somewhere between 3 and 6 weeks after you've had it, your body will develop antibodies, and we can measure those antibodies taken in your blood and say, yep, you have antibodies to COVID, so you had it sometime in the past.
Right.
And so people get confused. They'll come and say, I want the antibody test if I have COVID. It doesn't tell you that. It tells you if you had COVID in the past.
So what somebody would be looking for, I would think, just for the accuracy, even though it maybe takes a day or 2 to get the results back, would be the PCR test.
Yeah, so we're offering all 3. And here's kind of how we use it.
We're at Healthcare
Yeah, I'm
Express,
sorry.
by the way. I'm sorry.
Yeah, so what we're doing at Healthcare Express, we were only doing the PCR because of the accuracy issues. As of late, we are now going to have all 3 available. And here's the reason why. Let's assume you don't have any symptoms. You feel great, but you need to take a flight somewhere, or you need to go visit your mom in a nursing home, and you need a thing saying you have a negative thing. Then the rapid test is great. You already knew you were negative. You got a test that says you're negative. That's a perfect test for that kind of thing.
Right.
On the other hand, you come in and let's say you say, I haven't had any taste for 2 days, I got a little bit of a fever, and I do a rapid test and the test is positive. Well, we thought that's what was going to happen. It is. Well, if I do a rapid test and it's negative. If I do a rapid test and it's negative and you think you have it, I think you have it, I'm going to send a PCR to confirm. Tell you to go home, quarantine, and let's get the PCR, the more accurate test. So I think you can use them in conjunction with each other, knowing when to use which one.
Sure.
And then I might have you come in and say, you say, well, I was sick with this very kind of thing about 6 weeks ago. I never went to the doctor. I never got tested. But I want to make sure because I got to go visit my grandma this weekend. I want to make sure I'm okay. I do an antibody test, see if you have antibodies.
Now, all right, so that we've covered some of the tests there, but
Yeah.
but now we're also at the time of year, people keep talking about, oh, well, how come we're not hearing about flu numbers anymore? There are still flu numbers.
Yeah.
There's flu out there, but now we have COVID. Yeah. What about vaccines for the flu, chills, pneumonia, all that?
So I always think vaccines are extremely important. You need to be getting them when you should be getting them on schedule. I think this year is probably even a little more important because what you really don't want to get hit with is something preventable like the flu if you had the vaccine. And we know it doesn't cover for every flu, but it covers for a large majority of them and happen to get COVID at the same time. Or if you come into your doctor and you say, I've had my flu vaccine, I've been sick for a few days, COVID maybe jumps up a little bit on what we're going to test for or think about. So it's just another way to kind of prevent extra disease burden when we already have COVID happening. And we end up with people in the hospital as an inpatient. We have elderly people doing poorly with the flu every year. What we don't want is hospitals saturated with COVID and flu, since we don't have any way to prevent COVID right now outside of the social stuff that we're doing, like masks and distancing and stuff like that.
If we could decrease the amount of people going to the hospital because they got their flu
Well, I
vaccine.
wanted to ask you about that, and I was thinking with you, I mean, I know you're doing, is it internship that you're doing?
I'm in my residency.
Residency,
Yeah.
okay. So you're at LSU over there, and I know you do a lot of emergency medicine. The advantage to come into, say, urgent care or clinic over an emergency center or a hospital at this time, I mean.
Well, I think for me, one of the biggest ones would just be the wait times. Most ERs you go to, you're gonna be there for a while.
Right.
In an urgent care, you're gonna get in a lot quicker. If you're not there because you have a if you think you need to go to an ER, go to
Yeah,
an ER.
if you can't breathe.
Right. But if you're there because you need a flu vaccine, or you're there because you have a little head cold, but you don't think you need to go to the hospital, you don't think you need any medicines, you just need to know an answer to the COVID test, urgent care is definitely an option to get in a little quicker. And the other side of that is it helps the healthcare system.
Right.
We have a
That-
lot of
that's what I meant.
Yeah, we'll have a lot less people in the waiting room who can be treated somewhere else, and now we get to focus on a little more high acuity patients and focus on the people who need to get admitted to the hospital or end up in an OR or something like that.
Well, Doc, what about folks that, let's say, they're doing poorly. Let's say they got diabetes.
Yeah.
Or they got, other issues that they've dealt with, high blood pressure, what have you. I've read where a lot of those folks are just not going to the doctor out of fear.
Yeah.
Is it fear?
No, absolutely. I think that, and just to kind of piggyback a little bit on what he said and add one more thing to that, the cost burden, right?
Okay.
The cost to go to a healthcare express, an urgent care center of some type, compared to the cost of going to an ER, it's not a little different, it's 10 times different. If you go to an ER for something that could have been easily treated in urgent care, just the cost burden is, a $200 bill versus a $2,000 bill for getting the exact same treatment. I think that's a big thing that people need to be thinking about as well.
How do you, it worries me to an extent, and I know doctors don't get worried, but it is flu season, and it is COVID, and you put those two together. So we want to encourage flu vaccinations for sure.
Absolutely.
But with the COVID, a lot of times people are getting pneumonia. What about pneumonia vaccines?
Yep, absolutely. So there's some pneumonia vaccines that are available for people age 55 and over, pneumovax vaccines. So you definitely want to ask your primary care physician about those. We can get those for you as well here, but if you have a primary care doc and you want to ask him about those. Shingles vaccines. I think shingles vaccines is a great idea for people who are elderly, over the age of 50. You're worried about shingles. If you've ever seen somebody with shingles, it's miserable.
Well, I'll be doing that before I leave.
Being able to get a shingles vaccine.
My brother,
it's terrible, right? It's a
sorry,
horrible
Doug.
disease, and it's very preventable. And so I think there's some other things like that. Getting back to your question about the thing that concerns me the most, the thing I'm seeing and the thing he's seeing on the inpatient side as well is COVID came, March, April, May, June, July, and what we saw was people got afraid. They said, running out of ventilators, and if I get on a ventilator and all these things, they got so scared.
From what they didn't know.
From what they didn't know, that what happened was we stopped going to the doctor for the things we should be that don't have anything to do with COVID. Like your high blood pressure, your diabetes, getting your medicines refilled, getting your mammograms, all the things, preventing colon cancer, getting your colonoscopies. And so I'm just here to tell people, you have more likelihood today of getting COVID at a restaurant you go to than you do going into the healthcare express. We take all the precautions.
Oh, yeah,
we have UV lights that decontaminate the air 99% of the time.
We have temperature checked.
People with temperatures checked, all the things. And so the message is it's safe to go to your doctor. Don't put off your healthcare problems. You're much more likely to get in trouble with your heart disease or your congestive heart failure, diabetes, than you are from the risk of getting COVID.
It's not just that, and I know with I don't know if how many have seen this, but you have a new book out.
Yes, sir.
You author. It's a best-selling book right now.
Thank you.
But it covers a lot of things, not just like your physical well-being, but your mental well-being. And so I saw a thing from Newsweek, and I just kind of perused it real quick. You know how you do. About these elderly patients in nursing homes that are kind of wasting away from no visitation. I mean,
It's terrible.
yeah.
It's terrible.
And you brought up something really interesting. In Texas now, if you can prove that you are negative, your family members in these nursing homes with a negative test, you could be named as I don't think it's primary caregiver, but somehow or another they can get you on the books. So we want to encourage you, if you have somebody that is in a nursing center, come to Healthcare Express, get your which
rapid,
one was the piece?
Get the rapid test.
The rapid test.
Get a negative, and then take it to them, show them that you're negative, and then they can get you in so you can see these folks and, you know, keep them from getting depressed and make them happy and make them feel better about things. For those of you who don't know, my book is called Living Every Minute, How to Create a Spectacular Life. Tim Reynolds, MD. It's on Amazon. Take a look. I'd love it if you got one. I'd love some feedback.
Well, I'm hoping that maybe we can talk again here soon and talk about that.
I'd love to.
Not just that, but also you've got a few programs that I find very, very exciting. The Gladiators and the Valkyries, and you guys want to get together maybe in the next couple weeks and talk about that?
That'd be great. We're very excited.
When you
about it.
I know you're back in Forest Shreveport and back in whatnot, but
So yeah, we're really excited about some of the things we have going on. I mean, honestly, the book coming out, you know, it's a 2-year project, and I knew it was going to come out, but there was something about when I was actually holding it in my hand, I was like, holy crap, it's real now. It's just something interesting.
And I've been following it, and it's exciting to me because, I mean, you got great people that are running the clinic, but this gives you, when you're talking about living every minute, you're not just talking about that, you're doing it and living by example.
I appreciate that.
And bringing these people along with you to do it. I just find it really interesting, and I think a lot of folks would really get a lot out of it.
I think so too. I
So,
appreciate it.
Guys, I appreciate you talking to me today. We're going to go ahead and get out of here and let you get
Awesome.
back to it. Is there anything else that we're missing? I know we talked about shingles and the pneumonia vaccines.
So if you do come up here to get a flu vaccine and you have any questions about vaccinations, you can go ahead and ask any one of the providers. Like you were saying, there's pneumonia vaccines and stuff like this. If you have pre-existing conditions, lung problems, stuff like that, it changes when you need them. You might even need them earlier than you think. Just go ahead and ask. It's not going to hurt, and it might be something that could end up keeping you out of the hospital.
And I know the good people here, well, not just here on Richmond Road, but any of the locations. You call, ask. That's really kind of, I like the way that you guys have kind of taken on education. And
Literally
it
here to serve.
It doesn't cost anything to learn.
Yep, absolutely.
So make that phone call. Thank you guys.
All right,
Give you a little
Thank
fist
you.
bump there.
Appreciate it, man.
Give you an elbow
Thank you.
because I don't know about you.